In today's talk, I'll be giving a few pointers on building a good research question. Good knowledge of the research area is vital in building a good research question. Last week's talk covers literature searching, if you need a few pointers on that. When you thought of a research idea, think, who's this work going to help? Is it going to help a lot of people or just a few people? And think of the size of the change it's going to make to those people. So you can have a big impact by having a big change on just a few people, or you can have a big impact by having a small change on lots of people. And then it's important to think about who's calling for this work. Have a look at the James Lind Alliance asking this research question already. A nice asking for this research to be done, because that's a really good justification to funding bodies if the question's already being asked. I suggest that you keep your research questions short and simple, and then you get it checked by those that will be involved in the research, the members of the public or the patients that are going to be involved, the clinicians, and then get it reviewed by experts in the field. When writing a research question, I always find it useful to think of the acronym Pico. And here we have Pico for quantitative research questions. So the P stands for the population. Who are the individuals that you're carrying out this research question in? The I stands for intervention, or at least it does in clinical trials. In observational studies, this is replaced with exposure. Then C stands for comparison. What are you comparing the intervention or the exposure to? And then finally, O stands for outcome. What is the outcome that you're interested in? If you're planning to carry out a clinical trial to answer your research question, then an addendum to the ICH E9, which is the statistical principles for carrying out clinical trials, highlights the importance of intercurrent events. Intercurrent events occur after treatment initiation and affect either the interpretation or the existence of the measures associated with the clinical question of interest. And here we've got some examples of intercurrent events. So you might want to think, will your research question or your study potentially have any of these? Treatment discontinuation due to adverse events, discontinuation due to lack of efficacy, or additional or alternative treatments such as rescue medication, change in background therapy, treatment switching, or what they term terminal events where you can't get the outcome measure that you want. So for example, you might be measuring outcomes such as foot ulcers in the foot and having a leg amputation, which means you can't get that outcome, or you might be looking at quality of life at 12 months and have a death at 6 months, which means you can't measure that outcome. So there are 5 different strategies for dealing with intercurrent events that were highlighted in the addendum, and choosing which of these strategies to take can be tricky, but it affects your research question. So you need to think about it, and it can help to speak to a clinical trials unit and say, this is my research question. These are the intercurrent events that I think we'll have in the trial. Which strategy should we use for dealing with each of these intercurrent events? So it's better to think about these issues up front and then make sure that you're going to deal with them the right way, rather than later on realizing that you haven't planned to deal with them and therefore you haven't collected the right information to answer the research question you want, or you're answering a slightly different research question to what you planned and it's not the important research question. So the general advice is, yes, start with your Pico, get your Pico done, and then once you've got your Pico, think, are there any intercurrent events and how do they affect the Pico, and discuss with clinical trials units or discuss with ourselves at the Research Design Service. I focused a lot on quantitative research questions in the last couple of slides, and that's because I'm a little bit like the lady in this cartoon. I just think of everything in quantitative terms. But when we think in qualitative terms, it's just as important for our research question to be well defined, and Pico again gives us a good structure to do this. So P is still your population. Who is it that you're asking this question in? I stands for your interest. What is the phenomenon of interest? And how does this relate to a defined event, activity, experience, or process? And finally, the CO stands for your context. What is the setting or distinct characteristics of your context? In terms of the aim, objectives, and title, we think it's best to go for a single aim, then break down that aim into major milestones in your objectives, and keep the title descriptive and concise. That's been a quick talk on asking a good research question. Hopefully that's helped you in developing your research question. If you do have a research question, you want to discuss it with us, that's what we're here for. We're happy to help you with that, and we'd look forward to hearing from you.